Assalamu alaikum wa rahmatullahi wa barakatuh. This is our second meeting. In the first recording, we discussed history taking and management planning for MRCPCH Clinical exam, and I think we highlighted most of points for preparation for this station, and I appreciate if there's any feedbacks which will help to answer any questions available regarding this station. Today we are going to resume our video recordings for the preparation for clinical MRCPCH exam, and today we are going to discuss the communication station. So as we know, clinical exam is 10 stations. 2 of them are for communication station. Okay, and the communication skills are not assessed only in these 2 stations, but actually all the other clinical stations you are going to be evaluated for your communication skills, and also history taking. Maybe we didn't focus on this part in history taking and management planning, because also you are going to be assessed for your communication skills, starting by greeting the role player and presenting yourself. So that will be a fixed rule in all communication stations, that you will start by greeting the role player and by introduction of yourself. So communication station will be 9 minutes, 7 minutes in which you will do the task, and the remaining 2 minutes you have to summarize the task. I mean, to summarize the information or the whatever you are asked to do in the communication, I mean the task, and to check the understanding. And time management in communication is one of the most important targets you have to achieve, because if the 2 minutes, the remaining 2 minutes after the remaining bills, and the examiner notes that you didn't conclude and summarize to the role player in a full satisfactory way, so that will be deducted from your final mark. So before these 9 minutes, you will have 4 minutes waiting outside, reading the scenario, and in these 4 minutes you have to do 2 main things you have to do before logging in to the examination. First, you have to write down the name of the role player, or the character the role player is acting. So you are going to write down it so as not to forget. As I mentioned, and I will keep mentioning, that if you forget the name, or you name the role player a wrong name, that will be a very bad point in your assessment. And the second thing is, and actually I prefer to do it as the first thing before writing down the name, the second thing is the task. It will be highlighted in the scenario, it will be in the box, and I prefer to start reading the task and then reading the scenario. Why I'm telling like this? Because it's very common mistake that we read the scenario, but we are not focusing on the task. then you think after you finish the exam that you did very well, you were very content, you were from the information, quality of information you are giving, it was very good, but finally you missed the track. You were not strict to that task, which is very important as well. So, based on the task, I will know in which category I'm going to categorize this communication scenario. Why do I have to categorize? Because based on the categorization, I'm going to use the suitable approach for the scenario. So, what are the different types of communication station? First is the consent taking. It's the easiest one, and there will be some steps we are going to discuss in this recording. And I think if your task is taking consent, you have to get the clear path, and you will do, inshallah. And then we have breaking the news, we have information giving, education, critical incident, some communications related to ethics, okay, and some miscellaneous. The problem the difficulties in this sequence, as I mentioned, we can say that the easiest at all is the consent taking. So, consent taking, because some people think in the extremes, think about the extremities. So, mentioning the consent means I'm going to take agreement from the patient or the one who's responsible for the patient, okay, for a certain procedure or medication or investigation, test, or blood transfusion. And that consent actually for the procedure of medication, it will be something very familiar to you in your practice. So they are not going to ask you to take permission for something you are not familiar to. Okay, they are not going to ask you to take consent for a certain surgery which you will not be able to discuss, okay, or you don't have enough background about it, because the main thing is to take consent for something you are doing in a daily practice, like LP, like starting chemotherapy, like starting taking consent for MRI, brain, something like this. And consent taking, I have multiple questions I have to ask myself first, and to find answers before I start this station. So I have to ask myself why I'm doing this procedure. So I'm expecting the player to ask me why. So I have to prepare the answer. Why? Okay. And how? Okay. Who's going to do? So who? Okay. When we are going to do, and it depends on the emergency and the necessity of this procedure. Where? Okay. Some procedures we are going to do bedside, some procedures we are going to do in a treatment room or in OT, or according to. And what are the possible complications or side effects for the procedure. Okay, and another how is how to overcome these complications. Okay, these are the most important questions, and we can add to them last question, what are the alternatives for this procedure in case I refuse, or the role player refuse. So first, let's take LB as example, as it's very common in exam. We will start by the routine steps. Let's assume that the scenario, 3-month-old with history of reduced activity, fever, okay, and patient brought to A&E. You did the septic workup, and you are asking for LB to continue your septic workup. So you are going to sit with the father, and let's assume that his name is Mahmoud, and you are going to take consent for LB for his son, let's say Haitham. So first of all, you are going to greet, good morning, I'm speaking to Mr. Mahmoud. So you identify who you are speaking to. He will say yes. Okay. And then he will say, I'm Dr. Ahmed, pediatric registrar here, and one of the team who's taking care of your son, Haitham. Is it okay to speak to you now? Yes. Okay. So the first thing, you greet the father. The second thing, you introduce yourself. The third thing that you are going to ask, like a question, it's just like an introduction to this setting. So you can say, okay, how is Haitham now? And you are expecting that he would give a small hint. And by the way, in all communication scenarios, there will be a note written, you are not allowed to take history. But this question, usually it's not a history. So it's expected to ask about how is he now, okay? He will say that he was having a fever since 3 days, and we noticed that he is not sleeping well, and in between he's less active as we used to, and all this. And then now you will tell him what we are going to do. So we'll say, as you mentioned, Mr. Mahmoud, that Haitham was having fever for 3 days and less activity, and actually in this age, 3 months old, one of the basic things to do in such case is to do a certain procedure which is called LB. If you mention LB, okay, so it will be considered as jargon. So if you are going to tell a jargon, it's not allowed to you to just say LB and stop. Then he will be panicked, and it will give a very bad impression. So we are going to do LB, then you are going to resume by telling, I know that it sounds not clear to you, this word. Have you ever heard about this before? Okay, so we are checking the background. Then he will say no or yes. Then you have to illustrate, and this will be a very good timing that you will use a plain paper and a pencil, and you are going to draw a very simplified diagram or drawing for the LP. You will draw the spinal cord and the CSF around, and you will through the vertebrae. It's just a crooked, and then you will tell him that in such case we will suspect like some infection, or if there is a bug which is in the circulating fluid and affecting the coverings of the brain. And usually we use a sample from this fluid. It will help us to identify this bug. And it's a safe procedure. It will be done in a clean condition with a professional staff, okay, who used to do this procedure. And we are not expecting to have any troubles. We are going to monitor the vital signs, and we are going to connect oxygen. We will give painkiller during the procedure, and we will enter in this space. It's totally away from the spinal cord, okay, the nerves, and we are going to give painkillers to avoid any pain. It will be just a prick to take the sample. It's like taking any blood collection, but this sample will be helpful for us. We are going to send for analysis of the sample, and what we are aiming at, that based on the sample we will be able to know and identify if he is having infection or not, and what type of infection we have, what bug we are dealing with, and then we will select the antibiotic suitable to treat him. Then he will start. You asked the question before if he had ever heard about it. Okay, so now you are supposed to ask for understanding. Are you following me? Okay, are you understanding me? Then whether he will say, okay, I know this, we faced troubles before, I know my cousin, he was having same problem and they did like this, and then he will have difficulty in walking, and I know somebody else who had similar thing and he had numbness. These are misconceptions, and it's very common between population. So we have to tell, okay, that again, to stress that it's totally safe procedure. What we are expecting, that some pain which we are going to overcome by analgesia, and like some site oozing of blood which will take care of, and it's a very simple procedure as it's done by a professional staff. Then he will say, okay, so if I refused, what are the alternatives? Then you are going to tell frankly, in case of your refusal, which I don't suggest to, but we will give antibiotic which is not specific, as we don't know the identity of the bug. So, and we will give for a duration which varies from 2 weeks to 3 weeks, and that will require staying in hospital. And we don't guarantee that he will be cured of or not, because it's not selective. So you will expect that he is going to negotiate with you, and he will ask for guarantees that there will be no problems, and you have again to stress on the benefits. So if we did the test, we will be able to know, identify the bug, and then select the proper antibiotic for this bug, and to know what duration we are going, for how long we are going to give. Maybe this bug is not available, then no need to treat empirically and give like 2 or 3 weeks antibiotics, which will require a hospital stay. So in this scenario, as I mentioned, we answered why we are doing this procedure, because we said it's mandatory in this age to do this procedure to know the organism. We answered the second question, which is who is going to do the procedure, how it's going to be done, okay, and we used illustrations and drawing where it's going to be done. So we would say that it will be done in a clean, well-prepared, well-equipped and prepared environment, and what are the possible complications and how we can overcome them, and what are the alternatives. And in between, every information I'm giving, I should check, understand. And then after I finish, I'm expecting the ring to bells. Then I will say summarization for what I have discussed. Okay, Mr. Mahmoud, as I understood that Haytham had a history of 3 days of fever and diminished activity, and you brought him to A&E. He looks lethargic for us, and we are going to do a certain procedure after taking consent from you. This procedure is taking a sample from his bag, okay, for the fluid circulating in his around his brain, and that will help us to identify the organism or the bug, to identify its presence or not, and to start this possible selective antibiotic for this bug, and as I mentioned, where it's going to be done and who's going to do this and what are the possible complications and how to overcome it. Do you have any questions? Then if he has questions, it's okay. If he's still hesitant to do, you are not supposed to force them to do, as it's not emergency, and if they selected the alternative, it's their choice, but you did your best to convince them. And even if you fail to convince them, you can ask them to sit with your senior, and maybe he will be able to convince them. And finally, you will thank them for listening and for understanding, and that will be the end of your communication station. Okay, it's very easy example is LB, and it's very common, and as I mentioned, you can apply these steps for any procedure, okay, and you have to answer all these questions. And in the next recording, we will discuss the different categories of communication scenarios. I hope that you enjoyed this recording. Thank you for your listening, and goodbye.